lead to another complicating layer for people who need to make their own decisions. As I've said, all of the vaccines available to us are effective and all of them are safe. For people who received a first shot of AstraZeneca, we continue to recommend that you get one of the mRNA vaccines for your second dose. And if anything, these new German studies strengthen that recommendation. And this is because the mRNA vaccines not only have been found in these studies to be at least as effective after a first dose of AstraZeneca, but also because the mRNA vaccines don't have that same rare but still present side effect of blood clots that we saw with AstraZeneca. So for those people, that means most of them will almost certainly be getting Pfizer or Moderna for a second shot. However, there are a small number of people who will not be able to get a second shot unless it's AstraZeneca. And that is still allowed so long as you have a conversation with your healthcare provider about the risks and the benefits. And you have to meet the eligibility requirements for the AstraZeneca vaccine. Johanu will give a bit more of an update on that in his remarks about how we're facilitating this. So that takes me to talking about vaccine interchangeability and what that means. The guidance on this has, like all of the science, been evolving. And at the same time, our teams are planning for the very real impact that vaccine supply disruptions can have. If you received your first dose of Moderna, for example, and you are now eligible for your second dose, but perhaps we're not expecting another shipment of the vaccine at the time that you're due for your next dose, you might be asking what this means for you. Si vous avez reçu une dose de Moderna, par exemple, et vous êtes maintenant admissible à votre deuxième dose, mais qu'aucune livraison de ce vaccin n'est attendue dans un avenir proche, qu'est-ce que ça signifie pour vous? Whenever possible, we recommend that you get the same mRNA vaccine for your second dose as you received for your first dose. That means if you got Moderna for your first dose, we recommend you get Moderna for your second dose and Pfizer to Pfizer. But as I said, these vaccines are considered equivalent. They are both safe and effective. So if your first dose vaccine is not readily available, for example, if you'd have to wait weeks longer to get a Moderna shot, compared to when you could book for a Pfizer vaccine, or vice versa, we want you to book for the first vaccine available. You do not have to wait to get the same vaccine as your first shot. Si le vaccin que vous avez reçu pour votre première dose n'est pas rapidement disponible, c'est-à-dire si le délai pour recevoir un vaccin du Moderna est plus long que de quelques semaines par rapport au délai pour recevoir un vaccin de Pfizer ou vice-versa, nous voulons que vous preniez rendez-vous pour le vaccin que vous pourrez recevoir le plus rapidement. Il n'est pas obligatoire que vous attendiez pour recevoir le même vaccin que celui que vous avez reçu la première fois. The exception to this approach would be young people aged 12 to 17. They must still only get the Pfizer vaccine for both their first and their second dose, as currently that's the only product approved for use in this age group. We can revisit this approach in the future, though, if Health Canada authorizes any other vaccines for this age group, after ensuring that it's safe and effective. We don't want you to have to wait. We don't want you to feel that you're stuck without options while other people may have the opportunity to book their second dose. This shift will help us fully protect more Manitobans sooner, and that is great news for all of us. Today, I also want to talk a little bit about the paperwork that is a necessary part of getting your vaccine, and that is the consent form. As more people are coming for their second dose appointments, we want you to know that we need you to have a second consent form as well. Aujourd'hui, je veux aussi parler un peu de la paperasse que vous devez remplir pour recevoir votre vaccin. Et je parle ici du formulaire de consentement. Vous êtes de plus en plus nombreux à vous présenter à vos rendez-vous pour recevoir votre deuxième dose et nous voulons que vous sachiez que vous devez avoir en main un deuxième formulaire de consentement pour cette deuxième injection. We know that you filled it out the first time around, but your health or medical conditions may have changed since then, and we want to know how you responded if you had any side effects, for example, from your first dose. And for some of you, the type of vaccine that you're getting for your second dose may be different than your first. So for all of these reasons, please plan to have your consent form ready. It is online, so you can go and fill it in online and print it and bring it with you. This will save some time on site and help you to get seated for your vaccine more quickly. It helps us to provide the smoothest experience possible. Last week, the mobile clinic gave COVID-19 vaccines to more than 40 people over 2 days. And while we have been so used to talking about the importance of getting the vaccine to as many people as we can, as quickly as we can, that number might give some of you pause. But these are 40 people who likely face a lot of barriers. They may face systemic racism and other challenges that mean they might never make an appointment and would likely not come to a supersite. This is the difficult work that we've been talking about. Our refocus on accessibility means putting a lot of effort into reaching smaller numbers of people. But importantly, people who, without this specific targeted intervention, would almost certainly not be able to get the vaccine. This week, we've allocated 180 doses with some additional medical partners helping so that we can have staff provide a second mobile clinic. And I want to thank the teams who are doing this very difficult but very important work. In these cases, the province is providing the vaccine and the clinical oversight, but the communities are providing the expertise on how best to reach people who will benefit from the vaccine the most in the place where they're at and from people that they trust. We will continue to keep Manitobans updated on this work and other initiatives to support equitable access to vaccine. With that, I will turn things over to Johanu. Thank you.
Thank you, Dr. Reimer. Good afternoon, everyone. I'm Johanu Botha, the Operations, Planning, and Logistics Lead for the Vaccine Implementation Task Force. Today, we have reached another important milestone. 70% of people over the age of 18 have received at least one dose of the vaccine, and the percentage of people aged 12 and up is not far behind. Vaccine numbers continue to rise, and that is something that I personally, and I know that everyone on our team is thrilled to see. This week, we'll give almost 90,000 doses in supersites, pop-up clinics, urban Indigenous clinics, and through our focused immunization teams. Next week, we expect to give about 83,000 doses through those same channels. And again, the number of doses we're providing each week does shift depending on the amount that comes in from the federal government. We expect to completely exhaust the vaccine supply that we do have in the province in a week. Yesterday, our supersite in the PAW opened its doors to serve the people of the North. With this, we've opened at least 2 supersites in every regional health authority. This has brought the vaccine closer to home to more Manitobans in a system that is fast, it's efficient and effective in immunizing as many people as possible. It has been nothing short of a Herculean effort over the last few months to get to this point. There are so many people on the task force, in regional health authorities, in our supersite communities, who have made all this possible. To each and every one of you, thank you for everything that you have done. You have saved lives. I am honored to be up here representing your work on behalf of the task force and to have the opportunity to recognize all of you. And as we've already talked about, we have begun distributing mRNA vaccines, Pfizer and Moderna, to our medical clinics and pharmacist partners. Last week, about 5,500 of Moderna were distributed to 23 clinics and pharmacies. And all the information we've received so far shows that those doses are getting into arms at a good pace. Over the next couple of days, we'll distribute another 6,000 doses of Moderna to about 125 of those partners. That's about the volume of vaccine we'll be able to deliver weekly through this channel for the month of June, either Pfizer or Moderna, based on the supply of vaccine we're getting and where else we need to use it in our system. However, we have also seen that there are some people who have a very strong preference for receiving their second dose of AstraZeneca if they received AstraZeneca as a first dose. And while Dr. Reimer has spoken about the clinical aspects of this decision, our job is to make sure that we have the vaccines we need when we need them. And as you know, we did have an allocation of AstraZeneca that we left with the federal government as clinical decisions shifted, and we saw very little demand at that time for this vaccine type. But the situation has changed, as it so often does in the vaccine rollout, and so we needed to respond. We requested and have received 7,500 additional AstraZeneca vaccine in the province. We are working with our partners in pharmacies and medical clinics throughout this week to develop a plan where we can strategically distribute them across the province based on public demand. Once that happens, sites will again be able to begin providing second doses of AstraZeneca for those who would like it. The task force has been working to make sure that we can provide the vaccine in locations across the province, based on clinical guidance, of course, and vaccine supply, of course, to make it as simple, convenient, and accessible for people as possible. And as we have talked about before, we have to ensure that approach also includes ways to reach people who just wouldn't be served by our super sites. We know that we've given more than 61,000 doses of vaccine to people in over 200 pop-up clinics across our province. This approach has improved our geographic reach for people who might not be able to get to a super site or other locations. We are also continuing to develop plans for community-hosted clinics to bring the vaccine closer to home and to have it provided by a known and a trusted partner. And where it makes sense to do so, we will be transitioning sites that used to have focused immunization teams to a new approach where they can order vaccines from us. This will let them immunize individuals when ready without having to wait for one of our focused immunization teams. Before I turn it over to questions, I just wanted to give a quick reminder to those people who did receive their vaccine out of province and have since returned home. We do want to hear from you. There are many reasons that you will want to have your immunizations recorded: to access the immunization card, to be entered into the vaccination lottery, or to book your second dose. For us, our planning teams want to also ensure your vaccine is counted among the hundreds of thousands already given to people in Manitoba, so we can continue to roll out the immunization campaign as effectively as possible. So if this is your situation, or if your immunization information is not entered correctly in our systems, you can now email us at COVID immunization records request at gov.mb.ca. Or you can still reach out to your local public health office. I wanted to share something quick that we received from Manitobans and with our colleagues on the task force. Sheila McGregor is a teacher at Inkster School in Winnipeg. She asked her classes to choose a frontline worker to write a letter of support to. Two of her students chose to recognize the vaccine rollout team. One grade 6 student wrote, "I know how stressful COVID is, especially when you cannot see your other family members. I can't even see my grandma because she got COVID a couple of days ago, and every day I think about her health, about her safety, and about our family. I wrote this letter so I could show my support to all the people who helped get the vaccine out. From delivery drivers to appointment takers to the nurses that put the vaccine into arms, you are all helping Canada, and I really appreciate that. Keep safe, keep doing what you do, and keep helping others. Another wrote, COVID is hitting the world hard, but with vaccinators, we are weaponized and ready. In my opinion, your role is one of the most important in 2020 to 2021. Hopefully we're done the rollout by then. Without people to vaccinate us, there will be no chance for humans to continue to live without worries in our heads. Hopefully everyone is getting vaccinated and we will all be safe thanks to you guys. Thank you so much to Mrs. McGregor and her students for these kind words. I know it will mean a lot to the people on the task force to hear all this from you. And with that, let's go to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from CBC Manitoba, Bart.
Good morning, or afternoon rather, Dr. Reimer. As Steve noted this morning, on June 3rd, you said that cash incentives could be seen as a bribe by some people for vaccines. Obviously, we have a lottery program today. What's the wisdom of that lottery program in light of what you've said previously?
Yeah, we've spent a lot of time looking at the science behind incentives, both financial and otherwise. And as I said before, we need to be very cautious when we use financial incentives, because for people who are already suspicious of the vaccine or of the government's intent, these financial incentives, if done in the wrong way, can make people more suspicious. What we saw is that the worst case scenario is giving just straight up cash for doses. That's really when people start to feel that there's some sort of hidden message or reason that government wants them immunized other than their own benefit. But we didn't see the same effect when it came to a lottery. Lotteries tend to bring about more of a sense of celebration and excitement with people. And so we'll certainly be watching this, because we know that human behavior changes from place to place, from time to time, and so even our best research on human behavior might not predict how Manitobans respond here. But what we want is to use every tool that we have to encourage Manitobans to get vaccinated, because my goal, the task force's goal, is to help Manitobans be healthy. We don't want to see any more deaths. We don't want to hear about anybody else in the hospital. And if a lottery helps to create just that slight incentive that takes somebody over from not being vaccinated to being vaccinated, then we're happy to provide that option.
Okay, so why is it that a lottery doesn't make people?
Well, I'm not a behavioral scientist, so I can't go too deep into all of the psychology of specifically lotteries, but some of the research that we looked at specifically looked at cash for action, and found that when you give certain amounts of dollars for specific actions, people will feel that the risk of the action is higher, and that wasn't reproduced when it was a lottery, because there was no certainty around the cash. So it was viewed more positively and less as a bribe. And so we are certainly hopeful that we'll see that same thing happening in Manitoba with the lottery. We also saw that even with our questions to Manitobans, but as well in the research, that when you have very large amounts, that can also influence people differently than if you're individually providing them with an incentive. And so that lottery approach, where we can provide much larger amounts, can instead, again, make people think of it more in a celebratory fashion, as opposed to anything negative associated with the dose, because they don't know whether or not they're going to get that money. And so it helps to maintain the reason that they're going for their vaccine, because of that uncertainty around whether or not they might be the winner.
And switching tacks for my third question here, by now you're familiar with that fact that we've got a growing number of Delta variant cases here. And there is the suggestion in that Globe and Mail analysis 9 days ago that we need 90% vaccine coverage population-wide to prevent a fourth wave. Now, that's their analysis. What, based on the studies that you're keeping up on and the immunology that you're looking at, what does our coverage need to be to reduce a Delta variant fourth wave?
Well, when we looked at the original type, we were expecting that about 70% coverage should get us to that textbook herd immunity, where there isn't enough susceptibility left in the community for the virus to survive. But many of the variants are transmitted more easily, and that includes the Delta variant that you referred to. And so we know now that 70% will not be enough to reach complete herd immunity. We don't have a great estimate yet for the exact number we'll need to reach. And even if we did, there's going to be another variant. And so we're going to be continually evaluating the science, continually evaluating the effect of these variants to target our goals and our interventions. But we certainly on the task force have no intention of stopping at 70% and really do intend to reach 80% or 90% of Manitobans. And what we've seen in Manitobans over the age of 80 is that that can be achievable. Over 90% of Manitobans over 80 years of age have received a vaccine. And so, we are going to continue to work towards that, because even if we reach the number that the Delta variant requires, that might not be sufficient for the Epsilon variant that potentially comes around the corner next.
From the Canadian Press, Steve.
Oh, hi there. Mr. Botha, we were receiving apparently 18,000 doses this week. I don't know if they've arrived already or if they're still in transit. But I know some pharmacies and medical clinics are anxiously awaiting these Moderna doses so they can start booking more second dose appointments. So can you tell us, I know you touched on it in your opening remarks, but can you tell us how soon these doses are getting out to pharmacies and clinics?
For sure. Thanks, Steve. That's 18,000 of Moderna that's en route. Most of it is still en route. It has not arrived in the province. It's not related to the approximately 6,000 doses that we will allocate to pharmacists and docs approximately every week, at least for the month of June, and then maybe more after that. So while we wait for that Moderna to come out, most of which will likely be used for pop-up clinics, for which appointments have already been booked. It won't impact any delays on that shipment. Shouldn't impact what we're able to provide to our pharmacist and physician partners. Now, it's not a tremendous amount that we're able to allocate out to them every week of June, the 6,000. They went through their 5,500 fairly quickly last week. But that's sort of the supply scenario that we're still in for this month. In terms of how quickly it goes out, once it's in province, it's within the next day we start shipping it out to the various sites. So we understand that our partners are eager to receive them. Once Moderna or Pfizer is available for them, we do send it out. And it will vary. So we don't receive enough for all of our partners. There's about 500 that are registered in our system to at any one of these weeks for all of them to get an amount. It'll be always a certain portion of these pharmacists and clinics, but we are as eager as they are to get doses to them.
And the federal government, just a little while ago today, said that Moderna has confirmed the delivery of another 7 million doses by the end of June. Of course, that's nationally and arriving nationally. Does that alter your plans? Because I know there hadn't been any confirmed shipments beyond this week.
There still are no confirmed shipments beyond this week, so we know we sort of have a guess at what our allocation might be per capita from that amount. We don't have the confirmed allocation or the confirmed shipment from the federal government. We certainly hope to have it in before the end of June, but we're still waiting for that information. In terms of what it means for our planning assumes it to come in. So when we look at our overall timelines for what we can do by the end of July, we still do assume that amount of Moderna will come in at some point, but between now and then. So this wouldn't be an extra amount; it would be what we've been hoping for already.
Okay, and in terms of the eligibility, I know today we've expanded the eligibility by a couple of days. Looking at the booking sites, we're booking into July now. There are very few short-term appointments available. Is there a reason for that? Is the uptake greater than expected, or has there been a delay in supply that has sort of caused this bit of lag between being eligible and being able to book an appointment within 3 or 4 weeks?
There's a couple things going on there. For certainly the amount of Moderna that didn't come in early mid-June has an impact on how many people we're able to make eligible for their second dose and the speed at which we can do that. But I think something else that's going on is we've always allowed booking out for about 3 weeks, assuming we had a confirmed shipment delivery that would be coming in that far out. The folks who are booking now are largely second dose individuals, and they're very enthusiastic about booking. When we open up a new second dose cohort, they start booking fast. They don't wait a couple of days. It doesn't really stretch too much over time. So the outcome of that is that individuals sort of get in the queue as fast as they can, and that means we're booking out 2 to 3 weeks. Partly because from the Pfizer shipments, we have confirmed shipments going out that far, so we can book out that far.
From CTV Winnipeg, Michelle.
Hi, Dr. Reimer. You just said that 70% isn't enough for herd immunity. Other provinces are using that as a benchmark to reopen their economy. What has been your advice to the committee that's working on our reopening plan regarding vaccination levels?
So 70% vaccine uptake won't take us to that textbook definition of herd immunity where viral transmission is not possible in our communities at all anymore. But that doesn't mean that at 70% that we wouldn't see much lower amounts of transmission. So while we're working on reopening plans, we don't intend to wait until we hit that complete definition of herd immunity where it's not possible for the virus to circulate at all. Instead, we're looking at an incremental approach to reopening where the lowest risk activities and locations would be opened first while we haven't hit the full herd immunity. And as we get more and more people immunized, that's when you can start to open up some of the higher risk locations and activities once we get closer and closer to true textbook herd immunity. But even if we never reach textbook herd immunity, that doesn't mean that we won't see massive benefits for Manitobans as far as the risk of spread, the risk of being infected. We may continue to see COVID in Manitoba for a long time. But if most people are immunized, we're going to see it at very low rates. We're going to see very few people end up in hospital. And we don't have to keep schools closed and businesses closed and stop people from seeing their friends and family when we have low numbers of people becoming ill and low numbers of people ending up in the hospital that would be more similar to, say, what we see with influenza, for example. So we are trying to balance the uptake of the vaccine with the riskiness of the different activities that might get opened up as we move forward.
Thank you. This one's for Johanu. I've heard that the supersite at RBC is really ramping up, like 8,000 doses a day. But the Leela site is like pales in comparison, like 600 and some doses a day. Why don't we have as many doses going through the Leela site as we do the RBC site?
Yeah, thanks, Michelle. It's purely about supply. These are both massive sites. They're both massive pipes. And so if we had more supply, we could send more into Leela. It's operationally much more efficient to sort of max out the capacity or get close to it of a site before flowing over to another site, as opposed to trying to keep them sort of both at a low hum. It's just in terms of labor and planning and staffing, it's much more effective and efficient to use a site fully before overflowing onto the other one. We have to remember too that we allocate vaccine to super sites across this province. We have demand and need across the province, and with the between 83,000 to 89,000 Pfizer we get in every week from the federal government, a good 90% of which approximately goes to our super sites. That is not enough to use all the capacity of all our sites across the province. There are still some cases, rural sites, there have been until very recently, where they can't operate on a day. And that's not because there's no capacity, it's because there's no supply based on what their population size is. So the moment we receive more, Leela will see more.
Okay, thank you. Also about the AstraZeneca doses, the 7,500 that we're getting, are these specifically for people who are allergic or have a medical reason to not get an mRNA, or can people who just simply want a matching dose schedule get a matching dose schedule for AstraZeneca?
Yeah, I can take that question. We know that without question, getting a dose of AstraZeneca is more beneficial than not getting a dose of AstraZeneca. So the risk of the rare blood clots is very low, and throughout this rollout, we've seen it remain low. The reason we recommend that people get an mRNA for their second dose is not because AstraZeneca won't work. It's not because AstraZeneca is unsafe. It's because the mRNA has been shown to be even safer. And potentially with these new German studies, even more effective. What we know so far is that in these studies, we're seeing a stronger immune response with the mRNA second dose compared to AstraZeneca's second dose. Some people, because of allergies, cannot receive an mRNA vaccine. So absolutely, we want to have a second dose of AstraZeneca available for those individuals, because the risk of AstraZeneca is much, much lower than the risk of COVID. There's other people who will never, for other reasons, choose to get an mRNA vaccine. And while we would encourage them to get mRNA, we would much rather that they got AstraZeneca as opposed to not getting a second dose. So we do want to have doses available to people who, for whatever reason, wouldn't otherwise get that second dose, because we want as many Manitobans protected as much as possible.
From City News, Mike.
Hey, good afternoon, everyone. Mike Albanese for City News here. This question is probably a bit tough, but more looking for opinion. You mentioned the science is ever evolving, so do we expect the time between doses to ever change, that period between Moderna doses or that period between Pfizer? And then would the province be able to adapt if, say, that time between got shorter?
So what we've seen already is that when you delay a second dose of an mRNA vaccine, you do get a stronger immune response. The reason we haven't changed our recommendation is that the efficacy that we saw in the original studies and the effectiveness that we saw in the real world studies was already so high that even that stronger immune response likely wasn't going to provide a big enough difference in the effectiveness of the vaccine to make up for the fact that people would have to wait longer to get that second dose and that boost to their immune response. The same can't be said of AstraZeneca, because what we saw in the original trial was a difference between 55% efficacy to 83% efficacy when people delayed that second dose. So that's a massive difference in the efficacy that we saw in the original trial, and that's why we did recommend delaying the second dose in that case, because it was the benefit of the delay was probably large enough to make up for the fact that people would have to wait longer to get that boost to their immune system. So we might, in the future, recommend extending the time between mRNA doses, but we would only do that when there's little to no circulating virus in the community. So when we're thinking, we don't currently have COVID here, but we're worried that maybe a fourth wave might come, maybe next season there might be more COVID, and it's safer to delay that boost, then maybe we would say something like it's reasonable to wait longer to get the strongest immune response possible. But while we're on the downslope of our third wave and we still have new cases being diagnosed every day in Manitoba, the benefit of getting the immune boost sooner with an mRNA vaccine exceeds any additional benefit that the delay could have to the immune response, because they're already so effective with the shorter time frame.
Thank you for that. You sort of answered this follow-up already, but I have to ask it anyway. So if people were to get their first dose as a Pfizer and then they know that their follow-up will be a Moderna or vice versa, does that change the recommended time between doses if you know that your second dose is going to be different?
So we're recommending right now across the board that people have a minimum of 28 days between doses of any products, because we know that now that we're treating them as more equivalent, nobody can be certain about what product they're going to receive. We are going to work very hard to provide the same product that people got with dose 1 if they got an mRNA vaccine. But it is possible that someone could come to a clinic and because of a shipment delay or a surprise additional shipment, that the alternate mRNA could be offered. And so in that case, we want to stick with the Moderna minimum interval because we want to make sure that people are longer than the minimum interval regardless of the products. So that's going to be the recommendation across the board, is minimum 28 days between doses, just to be sure that you've met all of the minimums. On top of the absolute new 28 days regardless, we have clinical advice for people who received AstraZeneca to wait 8 weeks before getting your second dose. Much like what I said earlier, that with the original AstraZeneca trials, we saw a big difference between the earlier and the later doses. We are worried that we could see something like that even if switching to mRNA. And we don't have any trials yet that gave the second dose at that 28-day mark. The Spanish trial and both of the German trials that have given us immunogenicity or immune response results, all of them gave the second dose 8 weeks or later after the first dose of AstraZeneca. So we can say that all of those trials showed us that there's a strong immune response, probably stronger than getting a second AstraZeneca if you get that second mRNA at least 8 weeks after the first dose. We can't say that as confidently if someone were to only get it at 28 days. So I think this is confusing for people. I completely understand why it would be confusing. And we're trying to minimize the number of different pieces of advice people are getting to bring everything together to say, your absolute minimum is 28 days. But if your first dose was AstraZeneca, on top of that, we recommend you wait 8 weeks because that's where the science is as far as the immune response data right now.
And then my final question is just, have you heard, is there any issues with people getting their immunization cards thus far? We've heard some people have had minor issues to major issues. So have you guys heard anything, and can you share that?
We certainly have heard that tens of thousands of Manitobans have applied for their card, and I think about half of them were not actually yet eligible to receive a card, either because they hadn't received their second dose yet, or it hadn't been 14 days since their second dose. I'm not aware of cards being delivered yet because this just happened. So I haven't heard any complaints about the system. I don't know, Johanu, if you've heard any.
No, I
issues?
haven't. I haven't either. I've got nothing else to add to that part.
From CHVN, Taylor.
Hi, good afternoon. What should people in that position of having the choice of different types of vaccines be considering?
Are you referring to AstraZeneca or mRNA options?
The both.
So normally in public health, we have more time to evaluate all the science and communicate a clearer picture for people. And unfortunately, because it's a pandemic and things are happening so rapidly, Manitobans are being faced with changing messages all the time. And so it's confusing to try to keep up and understand why you were told to get the AstraZeneca one week and not to get it the next week. So what we're saying today, based on the best science we have today, is that if you got a first dose of AstraZeneca, we recommend you get mRNA for your second dose 8 weeks or longer after your first dose. If you got Moderna or Pfizer for your first dose, we recommend that you get the same product for your second dose, unless getting the same product is going to delay that second dose. So if you go to book your appointment and you got Pfizer for dose 1, and you see that you could get a Pfizer appointment 5 weeks in the future, but there's a Moderna appointment available 3 weeks in the future, we recommend that you take the earlier appointment and get Moderna rather than having to delay that second dose and wait longer to get the same product. If they're equivalent and there's no delay, then sticking with the same dose same product makes the most sense, because that's where we have the largest amount of data right now.
And a lot of people were holding on to that 70% vaccination rate as, their benchmark for a hope for reopenings and herd immunity. They might be feeling a little disappointed now that has changed. What should Manitobans be looking towards when it comes to vaccination rates for these kinds of benefits?
Well, I think we're all disappointed when there's a variant that spreads more easily. Nobody wants to hear about COVID getting any worse than it is today. So what we're saying is that there needs to be a stepwise reopening that matches not just vaccine uptake. Also, we need to look at case counts, hospitalization data. But there may not be a hard and fast number that we reach and can say we've now achieved herd immunity, because these variants are all different. And so it's possible there could be future variants that are worse than the ones we're seeing today. So the advice for Manitobans is that we plan to stepwise reopen as vaccine uptake goes up, even knowing that 70% is not going to provide us perfect protection from this virus. And that's why we'll start with the lowest risk activities. We want to still protect Manitobans with both the vaccine and with public health measures, and we'll balance those two with each other as we go forward. So me saying that 70% doesn't achieve our perfect herd immunity doesn't mean that we have to stay with the same public health measures that we have today.
Thanks. And are you concerned about some communities with a lower uptake rate just not ever getting to even 70%?
I'm very concerned about how uptake might vary around the province, particularly if uptake is the low uptake is concentrated in an area, because if there's many people who are still susceptible, who are interacting with each other, that leaves a space for the virus to continue to survive and grow. And that puts all of us at risk, because there's that pocket where the virus can still be spread, and then from there out to the rest of Manitoba. So we want to do everything we possibly can to make it as easy as possible for people to get vaccinated, and to increase their confidence in the vaccine. We'll do as much work as we possibly can with both community and religious leaders to reach out. We'll do educational sessions, we'll do town halls, and we will try every tool we have in our toolbox to improve that vaccine confidence, because we don't want to see any communities continue to experience cases. We don't want there to be subsets of Manitoba where people are still ending up in the hospital. So absolutely, that's a concern, and our whole team is going to keep working so hard on this for as long as it takes. And you know, this is something that we're committed to doing.
From the Winnipeg Free Press, Danielle.
Hi there, and good afternoon. Dr. Reimer, given what we know about the Delta variant, are you of the opinion that the task force needs to accelerate second doses and perhaps drive down our inventory faster than the 10-day period that we've been using now, and why or why not?
Well, we can only give doses as quickly as they come to the province. So there's not really room to accelerate what we deliver. You know, every week the shipments come in, and every week we deliver the doses that we have. And if we had more doses, then I would 100% want us to use all of them as quickly as possible as well. I agree that the second dose is important, particularly with the Delta variant, but it's not more important than first doses. We still need to make sure that as many Manitobans as possible have some protection before we start to focus on those who are already protected getting an additional boost. So both first dose and second dose are critical. And every single dose that comes to Manitoba, we need to administer as quickly as we can, recognizing that particularly when we're reaching people for first dose, sometimes as quickly as we can won't be as quick as it was earlier, because these are individuals who are harder to reach. They're individuals who face a lot more challenges and a lot more barriers. And so it's a huge success to have our mobile van administer 40 vaccines, even though our supersite on the same day is doing 7,000 vaccines. And we need to be doing both of these approaches at the same time.
Thanks for that. And on the same note, or at least in the same vein, with the vaccine lottery that was announced today, has the task force done anything to prepare to get people who now want their first dose immunized quickly, because otherwise they're waiting about a month?
Yeah, so I mean, with our appointment-based system, when you book your appointment, you don't get ahead in the queue from when others have booked. That's sort of the nature of our process. It's fair, but it also allows for really effective planning. That said, one of the things we're looking at as a task force to introduce more and more, especially to support the clinical direction to get more dose ones into arms, is looking at things like a walk-in model. And we've done that already as a pilot project. We want to look at that more. How do we incorporate, especially as we get mid-end June, but really into July, how do we incorporate things like a walk-in approach at our sites, if that would attract those maybe previously slightly unsure first dosers, if you will. So in that kind of scenario, you would totally have the option, if you suddenly wanted your first dose but you were not so sure before, to go to this type of walk-in approach, which we are looking at. But outside of that, book the appointment. Book the appointment. The appointments are out between. Yeah, the second dose individuals are booking enthusiastically, so it means that all sites are booking out. 2 to 3 weeks, but it's 2 to 3 weeks, and then you get the dose. So it's exciting to be able to want the first dose and then walk right to a clinic. We're looking to make that option available down the line. But it's also exciting to get your name in the queue. And as we've always said, once that dose has your name on it, we protect it. That's the beautiful part about the appointment system, is it's yours now. So yeah, there's a bit of that wait, but you know when you'll get it and where you'll get it, and it's yours. So I would just encourage those with lottery or for other reasons, if they haven't got that first dose yet, booking the appointment should be as exciting as going to the clinic, and the booking part doesn't involve a needle. So.
Okay, thank you very much. And I'm a little uncertain on how this might work. So if a clinic has to change its mRNA vaccine offering, will people who have appointments be notified ahead of time? And what happens if they want to get the vaccine that they first signed up for? Do they have a choice?
So we absolutely want to respect the choice of Manitobans. They will be notified. If at all possible, ahead of time, if they had booked for a particular mRNA, via our appointment system, let them know that there will now on that day be another mRNA provided. If, as Dr. Reimer said, if there are, probably rare, but if there are scenarios in which that site that day has a different mRNA and we weren't able to communicate it out sooner, the clients will know on site. They will be provided with that information on site. They will have the option not to have the different kind. Our focus on the operational side is to respect appointments. And so if appointments have been made and then there's a drop in supply of one of the mRNAs, which we've seen consistently occur on the Moderna side, given that the clinical advice to us is, if there isn't the same type of mRNA available, the other mRNA is great. We want that option available for Manitobans. So we want to make sure that there is an mRNA attached to every appointment. We'll make every effort to make sure that it's the same one, but it may not always be. And the clients can then obviously decide what they would like to do, and then they could rebook for a different time if they'd like to.
From Global News, Anya.
Yeah, good afternoon. Dr. Reimer, how effective are the vaccines against this Delta variant? And similarly, what is the vaccine effectiveness after the first and second doses against this variant?
So we don't have full vaccine effectiveness data yet. What we have is data from the labs showing whether or not the antibodies that are generated when you're immunized can neutralize the virus in the lab. And so it did look like folks who had had 2 doses, they were quite effective at neutralizing the virus in the lab with the antibodies that they had. So that was very encouraging to see. There were some studies that made it appear that perhaps after 1 dose, the ability to neutralize the virus was lower. That one's a bit tricky because some of the studies included people in the 14 days after they received their first dose, meaning that they wouldn't have had time yet to generate those antibodies. So it's hard to interpret exactly how effective we can expect 1 dose to be against the Delta variant. But with 2 doses, most of the data so far shows us that there might be a slightly reduced effectiveness, but that there is still a lot, like a very strong protection against that variant from the vaccines.
Okay, thank you for that. And sort of on the same note, will we need a booster for this variant specifically? And how can we protect ourselves further besides just getting more people vaccinated?
So we don't know whether boosters are going to be necessary or not. So far, like I said, it does appear that the antibodies that the mRNA vaccines produce in an individual do neutralize this variant. So the 2 German studies that I was referencing, for example, one of them did look specifically at multiple different variants and found that people who had received the mixed schedule or 2 doses of mRNA were effective at neutralizing a variety of different variants of the virus. So far, it does seem like the existing mRNA vaccines are strongly protective against all of the existing variants, possibly a little bit less against the Delta variant, but still very early and difficult to know for sure. But even if it's less, it's still providing a high level of protection, even if it's not quite as high as the original strain. So I don't anticipate for any of the existing strains that will require a booster, but this virus is continuing to change. And so, we never really know what the next variant is going to look like. There are many, many thousands of variants around the world. Manitoba has several of our own variants that don't exist anywhere else in the world. Thankfully, the Manitoba variants are not more problematic than the original variant. But this virus can mutate, and so we don't know yet if we might require a booster in the future. And we don't know, if, say, for the Delta variant, if the immunity that we get from the vaccine might lower faster than it does for other vaccines. So we'll have to continue to do these studies in the months going forward to see if people who received the vaccine many months ago continue to be immune to all of the variants, including the Delta variant.
Okay, thanks for that. And last question is, do we know how many people are still booking their first doses of the vaccine?
We do. We track that. We're able to look at our appointment system and get a sense of dose 1 bookings and dose 2 bookings. What we're seeing is a very enthusiastic take-up rate or booking level for second dose individuals, and not a flatlining yet, but a real leveling off of booking for first dosers. This is partly why we are augmenting our sort of velocity supersite approach with our accessibility-based delivery models, whether it's sending doses to pharmacists and docs, whether it's continuing on with our pop-ups, and really looking at community-hosted or run clinics in really starting July, where the express aim there is to get first dose individuals who haven't had an accessible way to get it up to this point. We need those delivery models because we are seeing, both in the actual public health information management system for what has occurred, but also in our booking system for what will occur, that the dose ones are leveling off.
From the Brandon Sun, Kimberly.
Good afternoon. I'm just wondering if you know if there's any steps being taken to ensure all healthcare staff are vaccinated with their second dose, including long-term care homes, maybe some incentives, considering that families have to be fully vaccinated to allow access.
There's a lot of work going on in the healthcare system to encourage healthcare workers to be vaccinated. So one of the new approaches, which is not new in general, but new to the COVID vaccine, is that we are providing doses to the occupational health teams at different sites. And those doses will be offered to healthcare workers who work at those sites to help reduce any barriers that might come from having to book an appointment and go to a different location when they're working a lot of overtime right now and finding it very challenging to find days off that they can do that. So we are having a lot of town halls. We're having educational Q&A sessions for healthcare workers. We're trying to provide them doses in convenient locations. So lots of work going on, and I know Shared Health has taken a strong role as well in reaching out to healthcare workers specifically to try to increase the numbers, because we do see that as a critical part of the healthcare workforce and the protection of not only the workforce but all of the patients and that they serve on a daily basis.
Thank you for that. Do you know how likely it is to jump the queue for a second dose? Say somebody wants to get in sooner than when they are actually allowed to. Is that actually something that is happening, or absolutely not?
We have very little reports of that happening at a wide scale. We screen at the call center and through the booking process. There will be individuals who do try and queue jump, and there will be cases in which the screening doesn't catch them. But by and large, the majority of Manitobans are certainly waiting for their time to be eligible, and it's certainly, as Dr. Reimer said, clinically, you don't want to have your second dose but before you've achieved the interval. So the rush to the second dose is not that useful for individuals if they haven't met that interval. So we do see it, we do pick it up now and then, but for the most part, Manitobans are following the eligibility. And of course, our system, potential walk-ins in the future aside, is set up to minimize queue jumping via the appointment process. So we release new groups of people at a very specific staggered rate, and then only them they can book in, and then they sort of have to get in the queue. So the system is designed to make that difficult anyways.
Okay, thank you. And my last question is, do you have an estimate for the number of unvaccinated Manitobans or the those entering the country that are vaccinated that are coming from out of country?
I don't have an estimate on hand, either, especially not for those who are coming in who are not vaccinated. But this is why we're asking Manitobans who have been vaccinated outside of country to contact the central email address we provided earlier or their local public health office, so we can start accumulating that data and to see what percentage of Manitobans have been vaccinated outside of the country. So as that continues to occur, we should start getting numbers like that.
From CJOB, Clay.
Good afternoon. Dr. Reimer, can you explain why a lot of these studies regarding vaccine efficiency should be reassuring to the public? Some people have wondered about these findings because many of the time they involve under 1,000 people responding.
Well, the most reassuring information we have about mixing products actually comes from the many decades of research and experience that we have with other viral vaccines. So exchanging products is something that we have a long history of doing with other vaccines. We do that with influenza, we do that with hepatitis. There's many times where people might be offered a different manufacturer or even a different vaccine type for influenza when they come into the clinic. So that's the most reassuring, is seeing that throughout the many decades of research and experience that we've seen that in almost all circumstances, it's extremely effective to exchange products for individuals when they have to get a multi-series vaccine. So these studies are reassuring because they show us that this vaccine does not appear to be different than our experience with many other types of vaccines. So the size of the trials is small, but the findings are completely consistent with what we expected to see. And so that's where the reassurance really comes from, is that we're not seeing anything unexpected. In the German study, they looked at, despite being a small cohort of people, they looked at multiple different types of antibodies. They looked at some of the shorter term and longer term immune response antibodies or cell types, and found that across the board, everything that they measured, people who received mRNA after AstraZeneca had high levels of every single measurement. And so that also is reassuring to see that consistency throughout the individual trials, regardless of what they were measuring or how they were measuring it. So, you know, we did anticipate we would see these results, and so it's incredibly reassuring that indeed the results from these small trials match what we have seen over many years of work.
Okay, a follow-up here. I asked the Premier this question last week. Are we doing enough to vaccinate the homeless in Winnipeg? Some of these people have mental health issues. They may not even be aware of where they should be going to get vaccinated.
I can take that one. So, you know, I would say we definitely want to continue to do more, and hence why we're looking at these accessibility-focused delivery models. We've got, you know, a very, it looks like it's early days, but a very successful pilot project with our community partners with the mobile van outreach to underhoused Manitobans. We have the successful cases of our urban Indigenous clinics who often do serve some of those individuals as well. But we want to continue to look at how to do this better. I think for obvious reasons, supersites are not the most accessible way for these individuals to be vaccinated, hence why these kind of models. I expect that we will expand the mobile nature of our rollout in urban contexts, not just with a mobile clinic operationalized by a community partner, but a mobile clinic operationalized with a government asset, with a government van, not just here, but in other urban contexts across the province. So those are the kind of things that we're looking at. As Dr. Reimer had said, you know, 40 or so of those individuals received a dose recently, so there's good work to continue to build on, and we'll continue to do so.
All right, and final question, can the dose mixers, I'm sure this has been asked before, but can dose mixers be assured they're getting the same protection from severe outcomes as those who did not have to mix their doses?
So what we have is data showing that the immune response after mixing products is very strong. In one of the German studies, the immune response for people who received AstraZeneca followed by an mRNA vaccine was stronger than those who received 2 doses of AstraZeneca. So, you know, we are confident that this immune response is consistent with what we've seen with other vaccines. And so we are encouraging people to get the best vaccine available based on the science that we have today. So, you know, when we see those strong immune responses, that's reassuring. That shows us that the body is recognizing this as a boost as opposed to as a first dose. So it's seeing this as something familiar and responding in a strong way like it does to a second dose of the same vaccine. And so we anticipate that this will provide equal or better protection when faced with the virus in the real world.
Our final reporter this afternoon from the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Okay, just want to confirm that any Manitoban now that received an AstraZeneca dose as their first dose will have the choice to get an AstraZeneca dose as their second dose. I just want to confirm that's true.
That's exactly what we're working towards, to allow that to happen, yes.